join us again. Really appreciate everybody taking a little bit of time out of the last several weeks to learn a little bit more about what's going on in Gothenburg, and then specifically as it would relate to the COVID issue that many of us or all of us are really dealing with. Just a couple of housekeeping items. If you do have any questions that you would like to submit during the presentation today, we'll have an email address in the chat feature that you can pull up and submit any questions there. And then the other thing that we've always tried to start off with a little bit of good news each week. And I guess the good news that I've noticed in the last week is we're starting to see some businesses open up, and that's really good to see. A couple of them that have been used by our family would be the dentist's office. The one that I need to get used is to get my hair cut. I haven't made that appointment yet, but it's definitely on the list of things to do. So it's exciting to think that we've weathered much of the storm. We certainly aren't completely through this yet, but we're starting to see just a little bit more of a glimpse of normalcy. So definitely something to celebrate. We're going to start off right away with with Becky Jobman from the hospital. Becky, a few questions for you. As we look at Gothenburg Health specifically, it's my understanding that elective procedures have now been opened up, and that similar to the dentist's office or the getting your hair cut, that some of those services are now available. What is the backlog, or how do you prioritize what some of those elective procedures may be, and what's the sequencing of that?
Yeah, thanks, Nate. So yes, we opened up surgeries this week. And so just so everyone knows, we continue to always prioritize urgent procedures over elective ones. So those are ones that have been, the elective ones are ones that we can perform over the last month or so since those DHMs came into effect. But we're working through roughly 60-some surgeries and continuing to schedule more. But fortunately, this is kind of a good time for that to happen because summertime is typically a little bit slow for elective surgeries. So we're not adding a whole lot of new elective surgeries on top of the backlog. So that's giving us some room to work through the backlog effectively while still meeting our new demands.
Great. And I think Mick might have talked about it last week, but before those elective procedures, there's kind of a pre-sequence of events that occurs. Can you tell us just a little bit about what somebody could expect if they would be signed up to get an elective procedure done?
Yeah, so I think you're just alluding to kind of like the safety measures we're taking. So we are requiring that all surgeries get a cleared COVID test to make sure that they are not positive for it, because just due to the nature of surgery, once somebody is intubated or put under anesthesia, that can make everyone in the room more susceptible to contracting COVID if that person would have it. So we make sure that they don't have it. And we've just continued our regimens that we've had in place in the facility. So we have screening processes to minimize any sort of exposure contact between a potential person that has any respiratory symptoms that are in line with COVID. We keep them entirely separate, and we have like highly regimented cleaning processes and just kind of all those day-to-day actions to make sure everybody's staying safe at our facility.
Great. Good. So what would you say the capacity for those services is versus the demand right now?
Yeah, absolutely. So clearly, like I said, with that backlog of surgeries, the demand is high right now, but we're working through that backlog. We also, just for public information, do have two full operating suites, as well as an endoscopy or procedure room, and then 2 certified registered nurse anesthetists. So Gothenburg Health has been strategically set up for a long time to handle a high surgical volume. The thought was that if we needed to, we could be doing a scheduled or elective surgery and also always have the capacity to do an urgent surgery. So we've actually had that built into our facility since like end of 2014. So that's really great that we have that on hand.
Great. Sounds good. I've been hearing a little bit more about all the different types of tests. I think last week we talked about antibody testing, but a new term that I'm hearing locally is rapid testing. Can you tell us a little bit about rapid testing and what that is?
Yeah, So that's being able to turn around a test within 30 to 60 minutes within a facility. And so there's been a lot of talk about rapid testing for COVID, and it's definitely an ideal process because then we can quickly figure out who has it and who doesn't have it. When we first started testing for this, it was multiple days, if not maybe a week or more for that turnaround, which was almost not worth doing because at that point, maybe the person wasn't even contagious anymore. But with having that fast turnaround with rapid testing, we are able to get results out to patients and know immediately if somebody is positive or negative. So with that, we are working on implementing rapid testing for COVID-19 at Gothenburg Health and have already started the process of doing so. We're actually able to utilize analyzers that we already have in our lab, and they're FDA approved. And so just getting the final steps, which is basically the test strips to do that. And so hoping that we have that, I would say maybe even by next week sometime. I'm not sure of that timeline yet, but hopefully we will have that in place next week.
Great. That's outstanding news. I know for anybody that finds themselves in a position where they're wondering if they have been directly impacted by COVID and those around them, the sooner they can get that information, the better. So a big thank you to Gothenburg Health for getting that technology in-house and available. Appreciate it. So what if somebody does feel like they need to be tested? What would the protocol or what would the procedure to get from wondering about it to potentially getting tested? What would that look like?
Yeah, so you still need to reach out to your primary health care provider. So it would just take a call up to our clinic. We still have the virtual visits, so if you're worried about being around people, you could set up a virtual visit and then go through the steps and questions needed to get that determination made. But obviously you would have to come on site once your healthcare provider said it was okay to get the COVID test, then you have to come on site and get that swab done.
Great.
So, yep, just start with giving the clinic a call though.
Becky, I had a question come in through the queue. What if a business had a desire or a need to do a group test? What would that look like, or what would the qualifications be to qualify for a group test? What would that look like then?
Yeah, so they are still prioritizing tests for healthcare workers, first responders, essential workers. And so I don't know that a whole group would qualify unless there was a known exposure. But the rules are constantly changing, and as more testing becomes available, they're opening that up more for larger groups of that nature. So I think it would just come down to calling and talking to that healthcare provider and seeing if the situation would justify having a larger group tested.
Awesome. Well, thank you, Becky. I would assume that things will continue to change in a positive direction. That answer of having a rapid test or the potential to get tested by a group as recently as 6 weeks ago, that seemed almost unfathomable. And even last week, it wasn't being discussed about rapid testing, and haven't even heard a lot of that in the national news. So everybody stay tuned. I know the hospital's been very good about getting that information out, and really, information is only as current as getting it from a trusted source. So as things continue to change and evolve, please reach out to the hospital to get the most current information. Thank you, Becky.
Yep,
We're now going to go to Kate with Two Rivers. Katie, thank you for joining us today. Some questions for you. Masks continue to be an issue that comes up in many conversations as it would relate to COVID. Can you give us any updates from Two Rivers as far as masks? I know one of the questions, I'll just kind of sum it up. They're concerned about the amount of time they've spent in public and how infrequently they're seeing people utilizing masks.
Right. And so we still continue to emphasize that wearing a mask greatly decreases your risk of getting COVID-19, and it's still circulating in our area, as we know. So we would still say it's really important to continue to wear masks at this time and maybe into the summer.
Great. Any idea on the statistics for rate of transmission with wearing a mask or not wearing a mask?
The only percentage that I remember is if both parties are wearing a mask, the rate of transmission is 1%. If one person's wearing a mask, it's around 30%, but I can't remember the exact statistics. And then no masks at all, it's closer to 70 or 80%.
Okay, that's a pretty compelling case for why someone may want to wear a mask. Great. Another thing that goes along the same lines of wearing a mask, what percentage of people that have COVID are likely asymptomatic?
You know, I think we're still really working it out. That's why we keep doing these large testing sites to see, you know, how many of these people really are asymptomatic and how many people are still showing that they've got the virus in their system but have not been sick for several weeks. And I don't know that there's a really good statistic out there saying, you know, the majority of cases were asymptomatic, but there's definitely a significant number of cases that have very mild symptoms, and a lot of these people are thinking that they have a summer cold or allergies or something like that, and is more of what we're seeing.
Okay, great. The Twin Rivers, or Two Rivers, has been very good about communicating on the directed health measures. And as we were talking with the hospital just a few minutes ago, that information continues to grow and change and evolve regularly. Any insights as to what's coming down the pipeline as far as directed health measures? Oh, Katie, I might have muted you. I'm sorry. That's embarrassing. There we go.
Sorry, no, yeah. At working from home and got a screaming kid in the background, I'm sure it's bothering a little bit. So I know Governor Ricketts announced today that we have new directed health measures starting June 1st. And during June 1st, we're going to probably see the travel quarantine lifted. So travel will only be, I should say this again, quarantine will only be required for people traveling outside of the country rather than between states, which is really nice. We're seeing some team sports resume, mostly those sports like baseball, rodeo, golf, softball, volleyball. Those sports are going to be allowed. We're still not able to play soccer or have any other leagues that I'm seeing right now. More changes will include opening bars, bottle clubs, and gentlemen's clubs, but only permitting about 50% of the rated occupancy at a time. Gatherings will be limited to the greater of either 25 people or 25% of occupancy, depending on the building. That's included for any large event, but we still are parades, carnivals, street dances, beer gardens, those are still prohibited until June 30th.
Okay.
Directed health measures. And then there's a lot, sorry. Gyms and fitness centers will be able to have the greater of 25% of people, or 25 people or 50% of occupancy. And then, increased occupancy in restaurants and in barbershops. And then they are rolling out plans, and we're working toward it to review plans for wedding receptions and funeral wakes. Most of them are going to involve no dancing, unfortunately. So.
Okay. Well, doggone it. I fancy myself as quite a dancer, so that's maybe a disappointment to me. Okay, so really, if I was to understand a lot of that guidance, and I know it changes, and I would really encourage any organization or business to take the time to go to the Two Rivers website and really dig into your specific situation. But just some general concepts to recap: you need to try to create some physical distance, even in a workspace, or even in a worship space, or even in a civic environment where you're trying to be 6 feet apart and minimize that human-to-human contact. And masks would certainly be encouraged to be worn to help promote safety, correct? And that's probably the reason why there's restricted access to dining halls of 25% or gyms of 10 people or less. And some of those, that guidance relates directly to that physical distancing. So at a general concept, if our audience understands that, and then really encourage people to look at the specific details by going to the Two Rivers website and really digging into their individual situations just a little bit more. Does that sound about right?
That sounds right. And basically what it really boils down to is the restrictions are lifting, and we expect to see a general kind of freedom of movement maybe towards July. We're kind of waiting to see what comes down the pipeline and what changes as we lift restrictions. It can go both ways. I know in Denmark they saw little to no resurgence of coronavirus when they lifted restrictions, but we also saw that in Georgia when they lifted restrictions, people started getting sick again. So that's really, we're lifting restrictions as long as we don't see a second surge of cases.
Okay. Well, sounds good. And a big thank you to your entire organization for all the work they're doing on our behalf, and really appreciate the keeping us up to date with information as it does continue to evolve. And my guess would be that we're going to see new and updated information as soon as next week, if not tomorrow. So.
Yep. Hopefully tomorrow, but we'll see.
Okay. All right. Appreciate it. Thank you, Katie. Dr. Rhodes, here with us from the school. Dr. Rhodes, could you give us an update on the summer meal program?
Yeah, thanks, Nate. So initially when we went through our closure, one of the things that we were able to do was provide meals to children between the ages of 1 and 18 within the community. And that was extremely successful. We ended up serving about 4,000 meals a week. That includes both brunch and lunches. And so we did apply for and were granted a waiver for summer reimbursement on meals as well. And initially that waiver times out on June 30th. We did just receive information that there is a second waiver to apply for, which would carry through August 31st. And so right now we're in the beginning stages of filling out that application for that waiver. And in all likelihood, we'll be developing a plan to serve meals to kids across the community through August 31st. Very, very exciting news.
Great. Good. Along the same lines as summer school. Thankfully, I don't think any of the Wyatt kids are signed up that I know of, but can you give us an update on what summer school would look like?
Yeah, you know, as Katie just mentioned, there are some new guidelines that will be coming out with the most recent DHM. One of the things that we are anticipating right now is that the governor, working in concert with the Nebraska Department of Education, is going to release some guidance as it relates to summer school. What we're hearing right now is that's probably an early June type of situation where we will be able to have in-person summer school, of course, with guidelines of social distancing in place. And so I think that probably could be communicated as early as tomorrow, but I would optimistically estimate that we'll be looking at the middle of next week to get that information and then get it out to parents and kids in terms of that summer school program.
Great, thank you. And I know that Katie would have touched on it a little bit in general terms, talking about fitness centers and such, but what about the summer weights program or summer conditioning and stuff that the school would be directly involved with?
So last week, I believe it was last week, Governor Ricketts did make a statement that would allow schools to open up their weight rooms for kids. Again, that would be with the idea that it would be in groups of 10 or less, that we would still practice social distancing of 6 feet apart, and that there would be disinfecting of that equipment. That is, from a date standpoint, is scheduled to be open June 1st, or it's allowable to be open on June 1st. Right now, we're working as school officials to put a plan in place for a summer weightlifting program for our kids, but we want to make sure that we're going to keep everybody safe along the way. So we're not committing right now to being open on June 1st. We've got coaches working very hard on that. Our athletic department's working on it as well. We're trying to make sure we have disinfectant in place, that we have some training for our summer weightlifting sponsor and coaches in terms of disinfecting as well. So again, it's a matter of putting some local guidelines in place to make sure we keep everybody safe. But we feel like that's just right around the corner, that we will be able to open up our weight room to our kids.
Great. And I think this next question we received right kind of would tie to what they're getting prepared for with summer weightlifting. What are your thoughts on what we may experience for fall activities, extracurricular activities?
Yes, again, in listening to Katie and looking at some information that was released from today's directed health measure, I believe that volleyball was added to softball and baseball, and I think golf was added as well in terms of youth sports, beginning on June 1st for practice and competitive games, so to speak, on June 18th. So we are seeing some activities added in to the loosening of restrictions. I also did receive just moments ago an email from Jay Beller, who's the executive director of the Nebraska School Activity Association, that there will be more information coming from his office as it relates to summer activities and fall activities. So I don't know all the intricacies of that yet, but all signs are pointing to a lifting of those restrictions. My assumption is that the higher level of contact that the activity may have, the less loosening of those restrictions that we'll see.
Yeah. Okay. Well, we will stay tuned on that topic. What about in regard to just a normal resumption of the next year's school year?
We are trying to make multiple plans on what the start of the fall semester may look like. The CDC on, I believe it was Tuesday, did release about 15 pages of reopening guidelines for schools. We believe that we'll get more information from Two Rivers that will be useful. We'll get more information from our local health officials as well. So I think in terms of those decisions, I think the thing that we can say is we want to be timely with the decisions and the information that we provide to our community, but we want those decisions to be made with the best possible information that we can get as well. And so what we're doing currently is making multiple plans on what the fall may look like for our kids and for our school district.
Yep. Okay. Thank you, Dr. Rhodes. This next question, I'm going to rephrase it a little bit. I think it gets to optional enrollment. So what would have been pre-COVID for us may be more familiar if a student from Brady wanted to transfer and come to school in Gothenburg or vice versa. How does optional enrollment work?
So state statute on option enrollment has a March 15th deadline. And so it's a relatively early spring date as it relates to option enrollment. And that March 15th date relates to being signed out of your district, so to speak. So in most cases, it is a local decision after the March 15th deadline on whether a school will release a resident student to option to another district. Now, for the most part, historically in our area, our school districts have been pretty lenient, I would say, as it relates to the March 15th. In other words, most resident districts will sign out a student to go to another school district. And so whether we see any change with that legislation based on the recent events with COVID-19, I think it's probably too early to tell. But there is a little bit of leniency leniency as it relates to option enrollment.
And we're probably most accustomed, or most traditionally, we see optional enrollment to another school district. What if that optional enrollment was to a homeschool environment?
So that is not necessarily an option type of situation. At any point, a parent or guardian can choose to homeschool. They need to apply through the Nebraska Department of Education, and then they will apply for what they call an exempt school status. And they have to have their curriculum approved and some other requirements such as that. Once they're approved as an exempt school, homeschool, then they are no longer necessarily considered a student of residency within that district.
Okay. Well, good. Well, thank you for the great information. And if anybody has any questions, I know you would encourage them to reach out directly to the school. So yeah, thank you, Dr. Rhodes. Next set of questions are actually, Mayor Hudson, you get off pretty easy today. I think we only have one question for you. So Mayor Hudson, when will the city offices open?
Hopefully soon. Gary's monitoring the DHM guidelines. We will revisit it here around the 1st of June for sure, if not sooner. We are anxious to get them back open. So hopefully first part of June, there might be some changes to procedures. I think our hopes now is to still encourage online payments or payment through the Dropbox. That has worked pretty well the last 2-3 months, and would like to kind of continue that. But Gary is monitoring it real close, and so hopefully sooner than later, but first part of June is probably we will start with the opening up. And then as far as the library, that is still being discussed. They are still running some book club programs and stuff, but when we actually open up will be decided in June.
Okay. Thank you, Mayor Hudson. Gary Greer, our city administrator. I think you get off relatively easy this week too. I think we have one question for you. When the playgrounds and the parks reopen?
There again, it's kind of the same answer we give. Really monitoring what the governor says. Right now, we can't meet the standards for cleanliness on our equipment at our parks. So therefore, we're not going to open until we can meet those standards. So as things unfold, and I think they will in June, we'll be able to open those up. And as soon as we have the ability to meet the standards, we will open those up and have them running. Right now, we're kind of doing maintenance on them, and we're making sure they're ready for the kids. But it's wait and see at this point in time, but I anticipate mid-June we'll be able to do that.
Okay, great. And yeah, just for a point of clarification, because that was one of the things that surprised me early on in this process was when playground equipment was encouraged not to be used. I thought, geez, we'd be out in the public, and that could be a great way for families to socialize and burn off a little energy. But it's because that equipment is a surface where transmission could occur, right? And there's
two problems. One is that if you have good equipment, it generates a lot of people wanting to come there, families, and a lot of kids. And so you have to meet the 10 person or less. So I'm glad to hear the 25 person is going to come. That'll help us loosen that part of it up. But then the other part is spreading the disease, that there are standards by which we would have to have people cleaning the equipment every hour or better. And of course, we don't have enough city employees to do that in all the playgrounds that we have. And it just makes it a problem where we can't meet those standards. But I anticipate them being loosened up. So we should be okay. But yeah, there's all kind of things to consider. And sometimes those things that you have to consider aren't initially just really obvious or logical. But once you think about them, all that equipment that turns all the time and collects a lot of people, it just doesn't meet the criteria that we have right now.
Yep. Well, thank you, Gary. Really appreciate you helping us understand that just a little bit more. Next, we have Sean Kashke with us from UNL Extension. Thanks for joining us today, Sean. Sean, several weeks ago, we encouraged businesses to participate in a survey, and it's my understanding the survey is now complete. do you have an update for us on what that survey process looked like?
Well, I sure do, Nate. Thank you for letting me have a couple of minutes to give you an update on the survey. We did have a pretty good participation statewide. Over 7,000 businesses in Nebraska completed an impact survey. And they did break up the results by region. And Dawson County, Gothenburg is considered in the Central Community College region, just on the far western edge of it. But the results by region didn't really make a difference between one region, and they were within 2 or 3 percentage points with all the questions. So I'm not going to kind of go into the regional stuff just for the sake of time today. But yeah, 7,600 surveys was a really good response rate in just a month. And I really appreciate you and the other folks on the phone having folks complete the survey. And so of the folks completing the survey, the healthcare and social assistance was the largest number of businesses types, the special needs. Automotive repairs were a big. Most of the businesses reported on the right side of this screen were small businesses. That means 55% of the people completing the survey had between 1 and 19 employees. So that's who our target audience is. Most of our small businesses completing that survey were smaller, some retail trade. So the big takeaways here was 87% of that 7,000 something folks businesses said that the virus was negatively impacting their business. And the biggest impact, and this is no surprise from what we're talking about here in these town halls, is of course the businesses in the art, reputation, those types of industries. That's your movie theaters, for example, right? And places where you have to be together. Your specific healthcare types where it's one-on-one, the side services from the hospitals, and specific educational services. Of course, 93% with the food services or restaurants, which we got some, that's starting to open up, so that'll help. And Deb will get to that in just a moment about as we do start to open up for these impacted industries, what you can do. So she'll speak next on that particular piece. And so as Senator Williams had sort of mentioned in the previous call, did a nice job sort of recapping in a tools that our local communities can use in a housing workforce initiative. We want to try and get investment back into our community because just in this 1 month survey, this one snapshot, minus 44% of revenue, and that sort of translates to almost a third of employees were impacted, employment being down because of the virus. And again, this wasn't a whole lot different across the state in the 6 different regions. So the nice thing about being able to do this is as the state considers how to move resources, they know which types of programs to sort of focus. So really nice work, giving a good response rate to this. If there's more, if you'd like to see the whole report's about 50 pages, and I'm not going to go into that today, Nate, but I think Will is going to post it in the chat there. You can go to the NVDC website, and this data was also compiled by the UNO Public Affairs Research. So a couple different university departments working in conjunction with the State Chamber of Commerce and the Department of Economic Development.
Great. Well, thank you, Sean. And I can even remember when I took that survey, as a business person, I probably felt less impacted at the time the survey was taken. And as we've continued to stay in this altered set of normal, it really feels like that impact has only increased. So really appreciate the research that the universities are doing, and appreciate you taking some time to share that information with us today. So thank you. Next, we're going to move on to Deb Eggenberger. Deb, thank you for taking some time to be with us today. I know you've been busy working on a lot of different things, but a resource that you have put together, I'm really excited for you to share and tell the business community just a little bit about.
Thanks, Nate. Yeah, so the Chamber of Commerce has collaborated with a lot of folks on a business playbook. And that's just to offer some safety guidelines and some best practices to businesses as the DHM restrictions are loosened and more people are getting out and about and back to their daily lives. And so we've emailed that playbook to chamber members, and we've also made it available on our website at gothenburgdelivers.com. And if somebody wants it printed, I would be sure happy to print it and deliver it. That's great, or they can print it themselves. Just a couple of highlights for businesses, I think that maybe most have probably thought of, but maybe haven't, is first, you might want to rethink the way you handle things. And that's like everything from the way you take payments to the way you handle your merchandise, or simply allowing people in the door. I mean, there's a lot of businesses that are starting to take temperatures of people who come in. Others that are requiring masks before you can come into their business. And it's really all about making your employees and your customers feel safe. And that's how you're going to get people back into your business and keep your business going, is to make them feel safe. And so one of the real simple ways to do that is to be cleaning all the time and to let customers see you cleaning all the time. Because, you know, I know that it might not feel like it's productive to spend your time wiping down the door handles or scrubbing the countertop, or, you know, whatever the case might be. But people will feel more comfortable if they know that you're taking those measures to try to clean all the time. And that'll make them feel, your employees and your customers, feel safe in your business. So I think that's one of those things that I would highly recommend that folks do. And the other thing is, you might consider providing some hand sanitizer to your customers as they come in the door. That's safe for them and you. And if people have trouble getting that, I have some connections that I might be able to help you out with some hand sanitizer. Other things you can do is mark 6-foot distances on the floor. That, you know, nobody wants to be the virus police, but that tells your customers that you're thinking about them and you're trying to keep them safe and you're trying to keep your employees safe. So those are just a few things that people can do to get your customers to come back in, keep them coming back in. And if there's anything that the chamber can do, if you have questions, if there's something that I can help you out with, I'm more than happy to be of service.
Well, great. Well, thank you, Deb, and thanks for putting all the time and energy into developing your understanding of a very complicated topic, and then taking the time to put together that document that all of us can reference. I've looked at the document, and it's a very powerful resource. I know that I find myself in a position to help make decisions that I don't necessarily feel qualified to make. And having resources like what Deb's put together from the chambers and the Two Rivers website really helps give me the confidence that we are making the best of the situation that we do have. So thank you, Deb, for sharing that with us. Appreciate it.
But the chamber also has access to that report that Sean was talking about. That was in our weekly email today. And if somebody wants that, I can sure email it to them too.
Yeah. And one of the things you and I have talked about is how to communicate with our customers, and even the concept of just putting up some signs and help giving people some guidance on when they do enter into your business. Any thoughts there, Deb?
You bet. I've done a couple of those too for people that are also on our website that they can download and print, or give me a call and I'll print them and laminate them for you. You know, things like, please wear a mask. We're wearing our masks for you. You do it for us. Keep your distance. Please keep your 6 feet. Or if you're offering hand sanitizer, make a little sign that says, here's some hand sanitizer. Use it when you come in the door, those sorts of things. We just really encourage businesses to try to be as proactive and communicate what they're doing to their customers. That's really important, to let people know that you are trying to be safe and you are taking those extra measures to clean all the time. That and anything that we can do as a chamber to help with the signage, or if you have questions, or if you're not sure if you're doing it right, just give us a call. If I don't know the answer, I'll find somebody who does.
Great. I've been around Deb long enough to know that that's fact. If she doesn't know, she'll find out for you. So thank you, Deb. Really appreciate it.
You bet.
Next, we have some questions for Colton. Colton, last week you shared with us that we would start to see some of the child care centers start to open back up again. How are things going, and what can we expect to see in the future?
Sure. So like I said last week, this Monday, Building Blocks started up operations. Learning Adventures, we understand tentatively is going to start June 1st. So like I said last week, those 2 child care centers make up the vast majority of child care providers for us in town. So glad to see that they're getting back up and running. Much like everything else when it comes to these relaxed DHMs, we're easing into it. So at building blocks throughout this week. They had anywhere from 13 to 17 kids. So their numbers are down. They would expect to see more starting next week. And they're also hearing a lot from families, hey, we're going to be there June 1st. So what that's done is it's allowed building blocks to kind of figure this piece out. So they're really working through the kinks on pick up and drop off. Parents know they're not allowed past the doors. Teachers are doing a great job of cleaning their classrooms very frequently. They're eating in different areas to keep the kids separated. And really they're undertaking the biggest task, and that is keeping 3 and 4 year olds socially distanced as they go throughout the day. So a big shout out goes out to those providers in these facilities, because ultimately they're at work so that the rest of Gothenburg can get back to work too. So a big thanks to Building Blocks and Learning Adventures.
Yeah, it's interesting, Colton. It's kind of a chicken and an egg phenomenon. We spent time earlier in the meeting talking about businesses reopening and starting to have more and more access, but in many ways they need people there to operate those businesses, and in many instances we need the childcare available to support those other business operations. So yeah, very fascinating spider web on how all aspects of this call are really tied together. So I've heard, is it true that the YMCA is up and running with their childcare, but maybe only for the medical community's children at this point in time? Any updates for us there?
Right. So one thing that we saw as a result of these centers closing is we had a big need when it came to that frontline medical staff. So as I've said before, the YMCA stepped up and helped provide that care free of charge to those families, a great resource in the community. They're still operational, but as I said, as we get Building Blocks and Learning Adventures up and running, we're really encouraging families to get their kids back into their regular programs. From a developmental standpoint, that consistency is very important for these young kids, but also from a business standpoint. Look, it's expensive for the YMCA to operate a free childcare, and it hurts our local providers if they don't have kids coming into their programs. So we're really working on that and coordinating with families on that piece. But my message to the community is, if you can get your kids into your regular daycare provider and you're willing to do so, again, they are taking safe steps to keep things safe out there. Then that's going to help these providers out quite a bit.
Great. Colton, directive health measures certainly have an impact on early childhood and childcare. We have definitely seen an evolution in what those have been. Can you just give us an update of the directed health measures, what they currently are, and how different facilities are accommodating with that?
Sure. So under the most recent DHMs, the restriction is 15 kids to a room, or a smaller number if required by the state. So the reality is state ratios require that we have fewer number of kids than that anyways. I can tell you, like I said, with Building Blocks' numbers this week, they separated those 13 to 17 kids across 4 different classrooms. So we really are not concerned at this point about cramming kids into rooms. Ultimately, they can't do that anyways. So meeting those DHMs is not difficult. And in fact, I would say our providers do a great job of making sure, or are doing a great job of making sure that we're even more limited there.
Great. Well, appreciate all your updates for us on a very important topic. So thank you, Colton. Next, Senator Williams. I've heard the legislature's been scheduled to go back into session. Do you have an update for us, Senator Williams?
Well, we sure do. We were notified earlier this week, Nate, that the legislature, which has 17 days of the current session remaining, will be called into session July 20th. And we'll go for 4 weeks and do 2 weeks of 5-day weeks, and then a week of 4 days, and then a week of 3 days to make up the 17, assuming there are no changes in what's going on. So that's where we are right now. Just like when a business is opening, The legislature is trying to figure out how to open safely for staff and employees. Most of our staff, in fact, all of my staff has been working from home since we moved out of the Capitol back in March, and we figured out how to do that, but we'll need staff back. And the chamber is not set up for standards of social distancing and things like that. And you might be surprised, and maybe not, that the debate and voting at the legislature is currently under our rules not allowed to be done in any remote fashion. So you can't be holding a session by a Zoom meeting, and you can't vote remotely. So, and I doubt if those will be changed, although we have at least one senator and a few other followers that are looking at some alternatives to that.
Great, thank you. Any other updates for us from the state perspective?
Well, I just point out and thank you for your commitment to this, that it's 4:45. That's the earliest that you ever introduced me on one of these meetings to, so we're moving quicker even with the Zoom meetings. I've been on a number of calls talking about the opportunities that are presented to us following the challenges of COVID, and every one of us has spent a lot of time talking about the challenges. But the telehealth industry has experienced great growth, and I think for rural areas like Nebraska, that's something for us to really lean in on and understand that telehealth in the future will be a way of life for many things. Also, we have now proven to ourselves that we need better broadband connectivity across the state. We are fortunate in Gothenburg itself that we have fiber to the house. But many areas, even with our own school and our own hospital, when you send kids home to the country, in certain areas there is a lacking of broadband connectivity. And again, those are things that we will be looking at the legislature. The three big elephants in the room with the legislature are what we can do with property tax, what we can do with economic development with our current economic incentive program sunsetting at the end of this calendar year, and also what we can do with the next project in Omaha. All three of those things are major lifts, and we're very uncertain right now as to what the revenue picture will be for Nebraska. When you look at those numbers, we currently have 100,000 unemployed people in the state. You look at the numbers that Sean was demonstrating about business being down and who's affected. All of that ends up significantly affecting the revenue coming into the state in the form of sales tax and income tax. And those are the two legs of the three-legged stool that come into the state to support our state's programs. We don't want to have to change things like our aid to individuals, which are the important backbone of what the state provides through the Health and Human Services area primarily. So there will be a lot of budget talk that will come into play. So it's going to be a difficult 17 days. Hadn't planned to spend a month of my summer doing that, but that's what the senators will do this year.
Great. Well, thank you, Matt. Thank you for the updates. And I'm reminded of some of the positive things that have come from the situation we've all found ourselves in. I think we will continue to be more efficient because of some of the lessons we're learning today. I heard you speaking earlier today about the amount of Zoom meetings you've participated in today and the vast number of people you've been able to connect with. Prior to our paradigm shifting, we didn't gather in such diverse groups throughout the day in the same way that we are right now. Just looking through my schedule for the meetings I've participated in today, 6 months ago, it would have required an extensive amount of travel. We wouldn't have thought about having the meetings that we're having today in a virtual setting. And I think there are gains in productivity as a result of that. I was talking to Matt's son earlier this week. He's an attorney in Omaha. Even the court system, we're seeing an evolution in how much they're willing to do through Zoom and GoTo meetings. And I think we're going to sit in the shade of that tree for years and years to come. So thank you for pointing out the positives, because they are there if we choose to look for them. A big thank you to all the panelists and all the community members that have taken the time to participate in these meetings. Again, this week, I will ask that you take the time to educate other people about some of the developments you've heard about today. I think another big takeaway from today's meeting is as things are starting to open up, it's a very dynamic situation. I would encourage you on a regular basis to go out to the Two Rivers website. If you have a specific medical question, call the hospital. Those resources are there for us to utilize. We definitely encourage you to reach out when you're hungry for that information. Don't trust necessarily what you're seeing on Facebook or hearing in the coffee shop. Go directly to the sources to get accurate, up-to-date information. Thank you for taking time to spend with us today. Next week, because of a short week, we are going to not do our Thursday scheduled meeting, but we will resume on June 4th. So there will not be a meeting next week on the 28th. However, there will be one on June 4th. Thank you, everyone.